$426 million in federal spending over 5 years is coming for British Columbia healthcare. The federal health minister signed the deal with his provincial counterpart in Vancouver Tuesday, focused in two areas: long-term care and rare diseases.
So a lot of times when we hear these disease names, they're unfamiliar to us, or we think of them as being, rare. But the reality is they have a tremendously devastating impact, not only just on the individuals who have these diseases, but on their families.
1 in 12 live with a rare disease, and they're targeting the expensive drugs that these people require. Some on the very highest end cost $4 million per person per year. It's up to each province to decide which medicines are covered. $192 million is being set aside for that purpose. The rest, $232 million, is going for long-term care, particularly to enhance wages and benefits for 13,000 healthcare assistants in nursing homes. The province subsidized wages during the pandemic.
We were going to level wages across the sector. That was, in the first year, $165 million to the bottom line. And when you think that that's a lot of money, that's how much under the wage that group of workers was getting every year.
BC's Health Minister Adrian Dix says about 10,000 of the province's 30,000 long-term care beds are in public nursing homes. Most of the rest are publicly funded, but in private facilities.
You can't have a situation where you have, and this is why we took the action in the pandemic, one group of workers disproportionately being different than another group of workers, because the flow will be away from the public beds that are funded in private facilities. There'll be a flow away of workers.
Dix says the money will mean better recruitment and retention of HCAs, but didn't give a target for new hires. He instead pointed to existing programs, like BC's Health Career Access Program, as the answer to the healthcare hiring gap. In Vancouver, Jack Morse, City News.